Greetings and welcome to Moonshot Radio, where every moment is an opportunity to learn. I'm your host, Nivea Torres, Executive Director of the Kindergarten Readiness Collaborative, also known as KRC. Our vision is that all children in Indian River County will be ready for kindergarten. We proudly partner with the Moonshot Moment, transforming the next generation in Indian River County by having 90% of all children reading on grade level by the 3rd grade. With me today here in the studio is Vicki Soule, Chief Executive Officer of Treasure Coast Community Health. Vicki, welcome.
Thank you so much for having me here today.
We're very excited to have you, and I should also say that you are the host of a weekly show right here on Planet Vero, Community Conversations.
It is wonderful to be back in the studio, although a little disorienting since you're sitting in my normal seat.
We traded places today, right, Vicki?
We did. But it is so good to be able to be here and tell about some of the things that we do that I can't bring forth on our own Treasure Coast Community Conversations, since that is more outside community oriented. So thank you for this opportunity.
Well, thank you for coming. And Vicki, you know that we work with children and their families, and we really partner with Treasure Coast Community Health around a lot of initiatives. So we wanted to hear from you about what pediatric services are available to the community at Treasure Coast Community Health.
Well, we have the usual variety, physicals, well baby visits, immunizations, and we have a number of other things. And we can go into those a little bit later, but I want to make sure, in case someone is driving into their driveway or otherwise going to be turning the dial in a little while, I want to talk about vaccinations, and particularly flu vaccinations, because it is coming up to that season. And we are finding that there's still so much misinformation out there about taking care of our children's health while they're very, very small. So I would like to maybe address that in a way or two.
Absolutely, Vicki. And why are vaccinations so important?
For two reasons. One, it keeps the child healthier, okay? There are many diseases, either bacterial or viral, that children don't have a natural immunity to. So that means that we're not doing our job as parents if we aren't protecting them from the unhealthy things that they're exposed to, whether it's just out to the grocery stores, to grandmas, to private nursery care, or regular daycare. The children are exposed to different things. Even if we kept them at home, we are carriers to things we are immune to, but we bring those germs and viruses into our home. So it's very important from that point of view to keep our own children healthy. But it also keeps our community healthy. Not everyone can get a vaccination. We have adults that have a very poor immune system, and even giving them a vaccination would be detrimental to their health, okay? People that are receiving chemotherapy, for example, okay? We are purposely disarming their immune system to get rid of the cancer. It also kills those healthy immune cells. And so the herd effect, that is, keeping the entire community healthy by reducing the risk for all of us, has to happen at that individual level.
Vicki, what a powerful statement about keeping the community healthy. I think traditionally we think of vaccinations and we think of babies and children, but you're indicating that there are adults that probably need this and they can't. So your child is exposed because of the environment and the proximity and the contact that they're with these folks.
Absolutely. So we need to teach our children how to reduce their risk, because it's not just theirs. It's the risk of everyone else that they may be around. Teaching them when they sneeze to sneeze into their elbow, because a sneeze can carry 30 feet or more, okay? Those droplets expose other people. Not sharing things, whether it's, God forbid, a tissue, which just gives me the willies, but they share drinks. They don't even think about things like that. They'll sneeze and, you know, it's downward aimed on their pen and pencil, and then someone picks that up. So those kinds of things, it's sort of like the head lice lecture only just specifically to how to control that environment for them. And, the kids don't think much about it if you just remind them. It's like a please and a thank you. This is what we do. Okay. The other thing, obviously, is that we need to protect them through vaccinations. And I know that there are some people who don't believe in that, and I will address that. But the reality is that from the time that children are 2+ this year, we can give them a flu mist. So we don't have to debate, does my child get another poke? No, you're not going to be the mean mom and dad. Just take them in. It would be wonderful if we could do it before 2 years of age, but the flu mist actually goes up into their nose and they have to breathe. And little children, 6-month-old children, can't sniff, okay? So the only way to do a flu vaccination for them is with a shot. But the good news is they don't remember it as they get older, okay? And we've protected them to get older. Last year, there were 80 children in Florida who died of complications from the flu. 80 children. That's 2 classrooms of children that we could have saved, okay? Now, not everybody that gets a vaccination is automatically saved, but, the first shot gets you about a 95% protection for the community. And so we recommend boosters as well the very first year that they get immunized for the flu. Wait about a month, and then let us do the second one. And that's standard of care now, okay? The viruses are always changing. So just because they had it last year doesn't mean that they shouldn't have it again. And no, we don't have to wait a whole year to do so. If we didn't get to immunize your child with the flu until February of last year, of 18, that's okay. The flu vaccines are being sent out as we speak to the various pediatricians and centers. And so it's okay to make an appointment now. Protect your children. We've already seen flu A and flu B at some of our centers.
Vicki, that's certainly a concerning number that 80 children died last year because of the flu. Share with us any other precautions that families should take now that we're entering the flu season. Any other considerations?
Well, let's get rid of some of the myths, okay? We have a population that still believes, and it's incredible to me because there's been so many scientific knowledge improvements over the last 30 years, but sometime in the mid to late 90s, a physician tried to pair a correlation between getting your children an immunization and autism. They seemed to think at that time, this individual promoted the idea that the preservatives in the immunization material caused autism. It did not. Not only did it not, scientifically, we proved it. The Institutes of Medicine, disproved it in 2004. And yet we still have individuals who claim, I don't want to do that. I don't want to take the chance. There is no chance. In fact, that physician was disbarred because it was a fraud. It was a hoax. It was poorly done material. He jumped to a conclusion he could not scientifically prove at the time, nor does it have any bearing. It is a myth that continues. And I'm the first one to say, I don't want to do anything to harm my children or grandchildren. Not one thing. But when you measure the risks versus the rewards, I'm going to be the mean mom that says, yeah, I know it hurts for a nanosecond, but it keeps me keeping you safe. Okay? So that's one of the things that I think people have got to understand. And it's not too late. If you decided when your child was born that you didn't want to have them immunized against the normal childhood diseases or other things, then it's not too late. You can have them come in and get the immunizations as a catch-up, and that will still protect them going forward in their lifetime.
Vicki, I'm so glad you brought up the issue between autism and vaccinations. We get that concern a lot, and there are parents who bring this up. It's a myth. Let's dispel it. I'm so glad that you're here sharing this important information, because there are folks who say, well, what about natural healing and breastfeeding my child? Shouldn't that be enough? Shouldn't that be sufficient?
Well, natural immunity through breastfeeding is a wonderful thing, but it's not everything, Okay, it's based on the mom's immune system and what she's been exposed to. And I guarantee you there are a number of things that none of us want to be exposed to. Okay, we get a tetanus shot. We get pertussis or whooping cough. How many of us have had whooping cough? Okay, not too many. Maybe we had measles, mumps, chickenpox as a child, although those are also waning. But again, your body reacts to what it's been most recently exposed to, and over time, those titers, those levels of immunity decrease because your immune system is busy fighting off more recent things. So even though you may have an immunity to it, and when you are exposed to that, again, your titer will peak up. Just because you had a baby doesn't mean that you've suddenly got all of these titers active enough to give your baby full protection. So there's two things wrong with the breastfeeding is enough. One, it doesn't protect you against everything, and even the things it's protecting your baby from are not necessarily at the level it needs to be. Remember, their immune system is just starting up too, which is why we seem like we're giving more and more immunizations as the year goes by, and that in fact is true. But it's, again, for two different reasons. One is the more you stimulate the immune system, the more the ready response will be there when it comes across that germ or virus, okay? Hence, instead of giving one, like we used to some years ago, for a particular thing, we may now, because of scientific studies, in terms of optimization for each individual, or the best amount that we can give to protect them over the course of some years, if not a lifetime, that booster effect has to be done, okay? There's lots of things I could talk about, yes. but those are some of the most important things.
Vicki, you're sharing a lot of important information. We're going to take a quick break, and we will be right back.
Okay.
At the Kindergarten Readiness Collaborative, our vision is for every parent, regardless of income or zip code, to have the knowledge and tools they need to raise healthy children that are prepared for kindergarten. Our mission is to support our partners in developing a high-quality early childhood system that is family-centered. Our outreach and parent engagement specialists connect with families and build trusted relationships. KRC has chosen Fellsmere and Gifford as our two focus areas in Indian River County. Our Fellsmere office is located downtown in the City Annex, and our new Gifford office is located within Victory Park Apartments. Our administrative offices are now located adjacent to Healthy Start and Treasure Coast Community Health in Vero Beach. The Kindergarten Readiness Collaborative, developing a high-quality early childhood system for all children in Indian River County.
160 years, PNC has been committed to providing their clients with great service and powerful financial expertise to help them meet their financial goals. The PNC Foundation, which receives its principal funding from the PNC Financial Services Group, actively supports organizations that provide services for the benefit of communities in which it has significant presence. The foundation focuses its philanthropic mission on early childhood education and community and economic development, which includes arts and culture. Through Grow Up Great, its signature cause that began in 2004, PNC has created a bilingual $350 million multi-year initiative to help prepare children from birth to age 5 for success in school and life. For more information, go to pncgrowupgreat.com.
Are you becoming a realtor, contractor, mold remediator, guardian? In the state of Florida, these and many other industries require a Level 2 live scan background check for clearance to work in your industry. A1A Fingerprints is your certified live scan source from Broward to Brevard. And if you're a medical provider, you need to be registered on the ACA web portal. A1A Fingerprints will help you navigate and comply with the law. Call 772-494-6556 or visit a1afingerprints.com. A1A Fingerprints.
You can trust Sandpiper Pest Control, serving Indian River, St. Lucie, and Brevard. Certified by the state of Florida to treat homes, lawns, and termites. Fully licensed and insured. Priced right, effective, and friendly.
Hi, this is Joel, the owner of Sandpiper Pest Control. Sandpiper can solve your pest issues. No contracts to sign, just results.
Call for a free estimate, 772-589-0204. Sandpiper Pest Control, a member of the iTex trading community. Your iTex dollars are welcome.
We're back to Moonshot Radio, where every moment is an opportunity to learn. I'm your host, Nivea Torres, Executive Director of the Kindergarten Readiness Collaborative. And joining me today in the studio is Vicki Soule, Chief Executive Officer of Treasure Coast Community Health. Vicki, we're learning so much from you about immunizations and getting ready for the flu season. Right before the break, you mentioned whooping cough, measles, and polio. And some folks think about that as diseases that were part of the old days. Are those still prevalent?
Well, the reality is that many of these viruses have reservoirs in animals. And so it's a constant vigilance, particularly birds. It's a constant vigilance to ensure that we continue to protect against them until the CDC, the Center for Disease Control, says we're all right. And in actual fact, in 2009, they listed the information that measles had been eradicated in the United States. And that's not just a sense. It's based on number of reported cases, and they have to go down to 0 cases report for a number of months to years, okay? Unfortunately, the whole world is not on that same cycle, and measles are back. Mumps were back last year. There were 2 college teams, sports teams, lacrosse, I believe, that quarantined themselves because they all had the mumps. Could you imagine having the mumps, big jowls, and feeling of fatigue, a fever, all the rest of it that goes with a childhood illness when you are a young adult? It's terrible. So that's why we continue to say, immunize your child, okay? Protect them. The whole world is not on the same schedule. And as a matter of fact, in Europe, they're having a terrible outbreak of measles right now. And it's almost reminiscent of the flu pandemic that we had 100 years ago this year, okay, where over 675,000 Americans died from the flu because we didn't know about all of those things. We didn't have any tools to diagnose. We didn't have any preventive measures because we didn't know what caused it. We didn't have any treatments like our antivirals now. So I am not saying that measles is going to be pandemic here. However, I do want to caution people that they never really go away. Even polio, the Rotarians, the international group of Rotarians worldwide have been fighting polio, even with the assistance of the Bill Gates millions. And there are still 3 countries over there, not in Europe, but even further, that they just can't get their arms around. They keep having sporadic outbreaks. And as long as it's there, we have to keep protecting our children. It's our future generation. And I know nobody wants to be mean. I know how awful it feels to have your child crying in pain. But understand, it is momentary. Imagine the loss of a child.
So if you're a parent, a grandparent, a child care provider, take all the necessary precautions
Absolutely.
And make sure you get your child immunized.
The CDC has given great advice through the Food and Drug Administration and multiple scientific studies so that there is a standardization of what should be given at what intervals. And it does start young because we want to protect our children. And it's not too young and it's not too old. So again, if you were what we might call an anti-vaxxer, okay, who doesn't believe in it, and now have a child who's 8 or 10 or 12, go talk to your pediatrician about a makeup schedule, even if it's only select things, okay? I'm not endorsing that you only half protect your child. I don't think any parent would do that and say, well, only run out into our street, not the highway, okay? But go and have that conversation. It's best if you do it early to give them the ultimate protection as early as possible, but it's never too late.
Vicki, we work with a lot of families that have limited resources. What if families say, I just can't afford?
There's no such thing, okay? At Treasure Coast Community Health, we have insurance-provided vaccines, and we have Vaccine for Children, which is a Department of Health initiative to make sure no child goes without a vaccination. It is free. Free. Please bring your child in. even the visit will be on a sliding fee scale at Treasure Coast Community Health. Okay.
So I hope that folks who are listening to this
Me too.
very closely, it's free at Treasure Coast Community Health. And Vicki, share with us other services that you're providing at Treasure Coast Community Health that benefit the entire community.
Well, we have a lot of different services. I'm going to stay focused on the children aspect. We make sure that all the children that come into our medical services also get a quick dental exam. We teach the parents how to keep their teeth clean while they're still infants, so that by the time they get to 3 or 4 or 5, whenever they actually get into an official big boy dental chair or girl, that they still have a good, healthy mouth. So we advise them on nutrition, as most pediatricians do. But they actually get the fluoride in our office. They get to meet our hygienist. We do warm handoffs so that it's not so scary. They can do a tour of that. We do the same thing for our children that have attention deficit disorder or ADHD, hyperactivity, so that, again, it's a one family kind of approach to it. And within the pediatric arena, we're doing a couple of things that we have responded to community need. One is we have a wonderful male pediatrician who's doing circumcision on our newborn boys up to 15 days old. And again, that's important because not all the Medicaid insurances will cover that. So again, we have that on the sliding fee scale so that we can offer those boys and through their mothers and fathers good hygiene and lack of infection as they grow up, because you certainly wouldn't want to be taking a 5-year-old in for a surgical procedure, which might be traumatizing just going to the hospital when they could easily have it done. The other thing is we have a number of women who deliver prematurely, low birth weight babies. And because of the prematurity, we know that the lungs are the last to develop. And we have offered an injection that's very expensive and very, it's unheard of in this county because it's usually specialists that take care of it. We inject those babies once a month with just a little bit of material that helps them fight off any infections from RSV, respiratory virus, in their lungs. So that, again, gives them a boost. And we also offer allergy shots based on the allergist's prescription so that people don't have to go out of town in order to have their children receive the services that they need. You know, typically allergies go for a year in terms of those shots, and that's a lot to drive out of county 2 or 3 times a week.
Vicki, thank you so much for sharing all this valuable information with us. And I really want to thank you because we have benefited from the partnership, and there are families in both Fellsmere and Gifford that are taking advantage of the free dental and vision screenings for their little ones.
That too.
So thank you so much.
And we
really
love getting the books,
that.
so thank you very much. We're promoting reading everywhere we can.
We're supporting the community together.
Mm-hmm. Absolutely. Thank you, Nivea.
Thank you for joining us, Vicki. And until next time, this has been Moonshot Radio, where every moment is an opportunity to learn.
You've been listening to Moonshot Radio with your host, Dr. Nivea Torres.